your life you come across a nurse,
Mm-hmm.
whether that be as a child getting a shot, going to the nurse's office after getting injured, or even being a patient at a hospital. During those times, did you ever find that they did not talk to you?
Hmm.
So the reason why is because communication is very important.
Mm-hmm.
Where I'm going with this is that nurses need to communicate properly in order to find out what they need to from the patient. But with that, you need to have certain communication skills. So, where I come from that is certain skills that you're going to need. Active listening. You need active listening, open-mindedness, nonverbal communication, and time management. Now you may be wondering what I'm talking about when I'm talking about those things.
Mm-hmm.
Active listening. In order to finally figure out what's wrong with the patient, you need to first actively listen to them. You'll never know what they are undergoing or what they are feeling if you don't listen. Which brings me to my next point. Open-mindedness. If you judge the person before listening to them, we all know people have their biases and judgments. By doing so, it can skew the data you receive from them and create a point to where they don't receive the proper care. And if that were to happen, that could be considered neglecting your patient. And then, nonverbal communication. There are times where your patients can't tell you, but then you can see that after treatment, a patient will be wincing in pain even though you already administered a medication or you already worked out their limb that was supposedly hurting. But if you can see that, they didn't have to say a thing, you can already see that they're hurting. That's a good way to see that they're communicating to you they're in pain. Nonverbal communication, that's one example. Then to my last point, time management. Kind of like now, okay? So here's the dealio. I'm going to keep this short and sweet. As a nurse, you have multiple patients. Now with time management, when it comes to communication, that could be explaining information or treatment or procedure or even their own status to them. But you don't want it long and drawn out. Because if that is the case, and you talk to a patient for 20, 30 minutes about them, you're not going to be able to get to your other patients. And by doing so, if you can manage your time a little bit better, you can get to everybody while getting the information that they need.
Mm.
But I want to leave you guys with a little thought here. Would our healthcare system be the same if all of these skills weren't present?
Never thought of it before.
And that ends my speech.